Good afternoon, everyone. I want you to close your eyes and think about the fact I'm about to tell you. More than 130 people die every day of opioid-related overdose in the United States, and more than 10.3 million people misuse prescription opioids in 2018. Shocking. It's very saddening. It's very devastating for our nation. And why is it happening? It's no secret that opioids misuse and lead to overdose been going on for decades now. It's more shocking to me that we have all these programs that have been funded by government, but there's nothing been going on. We still have people dying. We still people getting addicted to drugs. We still have millions of people die every day of this. So it's crazy. The accessibility of this opioids drugs has been so accessible now that it's as easy as going to the store and buying a pack of cigarettes. I know. It's mind blown. Let's go with facts. How did it all start? In late 1990s, pharmaceutical companies promised that all doctors and health companies that these drugs, opioid drugs, are not addictive and are very safe to give it to their patients. So soon after, doctors start prescribing opioids and been prescribing at a high amount because they've been promised that it's safe, it's not addictive. Well, soon after, everyone realized, the patients, the doctors, that these opioid drugs are very addictive, and the misuse of them will lead to overdosing on it. So fast forward to 2017, we have 47 people thousand have died in results of opioid overdose, and more than 1.7 million people in the United States suffer from substance use disorder related to prescription opioids pain relievers. So yeah, it's so crazy. It's you get promised something and then you get something different in return. So now you're wondering, now that it's been since 1990s, 20, 30 years now, why are doctors still prescribing this? Well, it is a drug, it is a medication, so it is going to be used after surgeries, after accidents, pain muscle. It is a drug, so it is a good medication to use. Now, when you give a medication to somebody with in the wrong hands, something bad will happen. So I have two reasoning why this is still happening. Number one, which is another issue that we can talk about later, is doctors don't have a lot of time with the patients. They don't have enough to hear from patient about their pain, about their complaints. So what is the fastest fix is to give the prescription. Here we go to pharmacy. They'll give you your prescription and you're good. What happens? The patient comes back again, same thing 10 times. By the 10th time, patient's addicted. Now they have addiction. They want the drug. If they can get it, they will go to something stronger like heroin or something like that. So that's number one reason. Number two, I believe our healthcare in the United States is corrupted. I believe our focus is mainly on tertiary prevention, meaning the longer patient is sick, the more money they will pay, the more money insurance will pay for treatments, the more money doctors will getting. So it is beneficial for our healthcare, in the United States, is to focus on tertiary prevention because we get more money and everyone's happy in the health field. Now, if we put money towards primary prevention, we would have more healthier people, but that's not the situation. So, solution, which is somewhat in process, but not really. So, how do we fix this epidemic crisis? I believe it is needed to be regulated by laws and policies, and the ones are responsible for all this are doctors. They are the one giving prescriptions. So what do we need to do? We need to inform laws that tell doctors you cannot prescribe more than one prescription to a patient, meaning on one paper or one sent to the pharmaceutical email, giving only one prescription refill, and that's it. Now, depending on the pain or surgery the patient had, the amount of pills can be distributed. So if you had a big surgery, you might have a little bit more pills in your one dose of prescriptions. But if you have something less pain but still needed, you give smaller amounts. And I feel like that will help a lot. And now people saying, well, they can go to one doctor, say this, one doctor say this, go to different hospital, prescribe opioids there, prescribe opioids there. Well, a lot of people know there is a system called electronic healthcare records, which means doctors from different hospitals, pharmaceutical pharmacies, they have access to see patients' file, patients' health history, patients what they've been taking, for what they're taking, how much. So there is a system in our healthcare system that shows that what history that patient had through electronic health records, EHR. So it is in place that we regulate how much we know we give our patients. But just because we know, we're not obeying what we're doing after that. So now it is doctor's job and healthcare professionals' job to make sure we don't overly excess amount of opioids to the patients. I feel like if we start doing this now, get the laws, if you continue prescribing prescription to patients just because you don't have time or it's just more convenient for you, you are going to be fined and initially maybe even thrown in jail, because this is serious. People die from this. This is not some little crisis. This is a major epidemic crisis. So we need to start doing this. We need to establish this laws now and help our population to become healthier and avoid all this mortality because of opioids misuse. Thank you.